House has before it House Bill 1430, which has been read. Mr. Chief Clerk.
Mr. Speaker, engrossed House Bill 1430 was introduced by Representative P. Anderson, Glassheim, Hawken, Marigold, M. Nelson, Schneider, and Strendon. Engrossed House Bill 1430 is a bill for an act to create and enact Chapter 19-24 of the North Dakota Century Code relating to the use of medical marijuana, to provide a penalty and to provide an effective date. Mr. Speaker, this is a fiscal note prepared by the Department of Health. Their analysis indicates in the general fund for the 2015-2017 biennium, revenues of $1,798,200, expenditures of $1,854,600, appropriations of $1,854,600,000. In the other funds category, revenues of $56,300. For the 2017-2019 biennium, general fund revenues of $3,657,800,000. Expenditures of $3,714,142,000. Appropriations of $3,714,142,000. In other funds, the revenues of $56,300. Mr. Speaker, your Human Services Committee recommends amendments which were passed on the previous sixth order. When so amended and engrossed recommends do not pass on engrossed House Bill 1430 by a vote of 8 yeas, 3 nays, and 2 absent not voting. Mr. Speaker.
Representative Weiss.
Thank you, Mr. Speaker, members of the Assembly. Your committee, by a vote of 8-3, recommends a do not pass on House Bill 1430, which is commonly known as our medical marijuana bill. And first thing I want to say is we did have a really good hearing on this bill, and I want to commend those that, particularly the parents that showed up and testified on this bill. It took a lot of strength and guts for them to basically lay out their lives and give us a story of how some of their children were suffering. And to be honest with you, I'm not so sure, if it happened to my sons, if I maybe wouldn't have been in front of that committee also to ask for this bill. But, having said that, your committee has to take a look at how this affects our whole state, the effects on the whole population of the state. Your committee did not fix this bill, so I want to be upfront about this. We did adopt some amendments, but after discussion in the committee, and I commend the committee for it, it became obviously that the discussion was really about whether we should allow medical marijuana or not on the details of the bill. So we had our discussion on that, and the vote is as you see it. And I think the reason, as we look at this, and the reason it had the do not pass, is there were so many issues that were very hard to overcome. One of it was the safety and the quality of the product that would be available under this bill and prescribed by doctors. And I have some information here that I'd like the Assembly to be aware of. Basically, 30 milligrams of THC is considered the point of intoxication, even less than that for children. In Colorado, they tested pills, that are currently being prescribed for medical marijuana. The pills are advertised as 100 milligram THC. So first of all, if you were to give one to your child, now you're going to have to break it down to roughly a third of a pill or less. But what was really interesting is when they actually tested the amount of THC in those pills, they ranged from 0, which meant you're getting severely ripped off, to 146 milligrams of THC. 100 milligrams of THC can cause severe toxic shock in children. So the problem is the state has no ability to control, regulate, and have the quality control that's necessary that we see in our current process of approving and regulating drugs. Now, I think there was no question that marijuana is probably not any more dangerous than many drugs that are currently being prescribed and available on the market. But they have heavy FDA regulation. Earlier in the session, our committee heard testimony, and we passed a bill out of this chamber having to do with prescription drug monitoring and trying to tighten it up, because one of the toughest drug issues we face is the abuse of prescription drugs that, again, are heavily controlled and regulated through a process of FDA and through the pharmacies this bill and these products would be outside of that. So your committee had real concerns on one, how do you ensure that any patient is getting what they need to get? Is it in the right dosage? Are they purchasing what they think they're purchasing? Those were part of the concerns. The other concern, of course, has to do on the law enforcement side because marijuana is illegal. And so you have that gray line between legal for medical use but illegal for other use. How do you ensure that it doesn't, the legal product, fall in the hands of, say, those who don't have the medical card and aren't able to use it? So your committee looked at all of these issues that just didn't appear to be, that could be resolved at this time. Also, the other thing we looked at is the fact that there are currently 2 products that contain THC that are currently labeled, FDA labeled. They have a label for vomiting and nausea and anorexia. So there are products already available. There's also a nasal spray that's in clinical trials right now that hopefully will have FDA clearance in the near future. So I think for those reasons, even though I think there wasn't anybody in the committee who didn't have sympathy and understand where if you feel this is your last resort and that none of the currently cleared products is doing any good for you and you're willing to try anything, we just felt that the concerns and the risks at this point in time outweigh the potential benefits that there might occur for a small group that feels that none of the currently available drugs work. Our hope is the FDA will look at licensing more and more products that may contain THC, so they maybe address some of the issues, but at this time we felt this is premature. I would hope that this body would concur with the committee and give this bill a red light.
Representative P. Anderson.
Thank you, Mr. Speaker. Mr. Speaker and members of the Assembly, I introduced this bill after one of my constituents, Ray Morgan, a 64-year-old financial planner, sent me an email after the election asking me if I would consider introducing a bill that would legalize medical marijuana in North Dakota. He suffers from chronic pain with neuropathy and would like the option for pain relief other than oxycodone and morphine. After doing some research, I found the following 23 states have legalized medical marijuana: Alaska, Arizona, California, Connecticut, Colorado, Delaware, Hawaii, Illinois, Maine, Maryland, Massachusetts. I'm going to read them all. They've all figured it out. Michigan, Minnesota, Montana, Nevada, New Hampshire, New Jersey, New Mexico, New York, Oregon, Rhode Island, Washington, and Vermont. The following 10 states have pending legislation in 2015: Florida, Georgia, Indiana, Kansas, Kentucky, Missouri, Nebraska, North Dakota, Pennsylvania, and South Carolina. The states are blue and red all across the country. This is not a partisan issue. Of the 23 states that have legalized medical marijuana, 12 were passed by the legislature. I told Mr. Morgan I would introduce a bill, and I started with the model medical marijuana bill from the National Conference of State Legislators. But after testimony from North Dakota Health Department and the Attorney General, the bill was amended to take out growing your own, and you can't smoke it. And of course you need a doctor's authorization. The bill before you is much more restrictive than the model bill and makes more sense for North Dakota. This bill is more like Minnesota and not Montana's. After we introduced the bill with bipartisan support, I received emails, posts, calls, all but one saying thank you for doing this and giving us hope. Their stories of devastating medical issues affecting them and their families are heartbreaking and compelling. Moms, dads, brothers, themselves. And they came and testified, some of them, before the committee. Congress has ended the federal government's ban on medical marijuana. The #1 cable news network did a poll in May of 2013 and found that 85% of Americans think Adults should be allowed to use marijuana for medical purposes if a physician prescribes it. In states with a medical marijuana law, overdose deaths from morphine, oxycodone, and heroin decreased by an average of 20% after 1 year, 25% by 2 years, and up to 33% by years 5 and 6 compared to what they would have expected. That's according to the results in the Journal of the American Medical Association, the internal medicine side. The American Academy of Pediatrics just recommended this month that the Drug Enforcement Administration reclassify marijuana as a Schedule II substance for its potential to help severely ill children. The fiscal note prepared by the Department of Health shows this is basically a wash. In the first biennium, they estimated we would have 4,068 caregivers and 8,135 patients in North Dakota with registration cards. The medical conditions that medical marijuana may help include glaucoma, cancers, seizures, HIV, MS, chronic pain, Parkinson's, Crohn's disease. The list goes on and on. This is not a drug issue, but a quality of life for the citizens of North Dakota. Mr. Speaker and members of the Assembly, I ask for your support on House Bill 1430. Thank you.
Representative Kiefert.
Thank you, Mr. Speaker and members of the House. I'm on committee too that heard the testimony about the evidence that this helps people. It didn't take long because there wasn't any. In this whole hearing, nobody presented a single fact that it helps anyone. Even the bill sponsor used the words maybe, perhaps, someday, possibly, and that's what we're dealing with. We pass legislation here based on facts, but if somebody wants to share a fact that it helps somebody, I'd be glad to hear it. Thank you.
Representative Schneider.
Thank you, Mr. Speaker and members of the Assembly. If some of you remember, the focus on marijuana during your college campus years was its party purposes. Times have apparently changed. The bill sponsors, and maybe some of the rest of you, were delivered by mail this morning to our desks, a scholarly research document from Minot State University. It was prepared in the fall of 2014 by the Nursing 456 public health class there, and it's entitled The Public Health Implications of the Legalization of Marijuana in the State of North Dakota. It studied both positive and negative features. It studied the positive outcomes of marijuana legalization, the negative outcomes of marijuana legalization, the distribution of marijuana, and the regulation of marijuana. And this document concluded that with proper education, regulation, and distribution, medical marijuana can have a positive impact on the state of North Dakota. It went on to conclude that it would support, this class and its research would support legalization of marijuana in North Dakota for medical purposes. It says, hopefully the information gathered during the research and assessment will assist North Dakota stakeholders and decision makers to come to an informed decision. For those whose interests in life and marijuana have shifted from parties to pain, I'm sure you will want to vote green on this. But know you will also be supporting the research of some responsible young nursing scholars at Minot State University. For those of you who are not yet ready to vote green on this issue, I urge you to pick up a copy of this document as we move forward on this issue. Thank you, Mr. Speaker and members of the Assembly.
Representative Hawken.
Thank you, Mr. Speaker. Mr. Speaker and members of the Assembly, I was in college during that time, but I wouldn't have touched marijuana with a 9-foot pole because it was illegal. As I told the committee, I only did things that were legal, like smoke cigarettes. I am on this bill because I am one of those parents. I have a child that has seizures, and his neurologist said, I am really sorry that I cannot prescribe this. The best news is, I think, is that there's been a discussion. We don't move real quickly in North Dakota on a lot of different issues. But there's talk, and it isn't yelling at each other, it's visiting with each other, it's getting the report from Minot State that has a lot of different information on it, both pluses and minuses. Now that the government has rescinded the ban on medical marijuana, there will be the opportunity for some serious studies. We were told by the bill carrier that there's a problem as far as standards. There is. And that's one of the things that we want to see helped, and so that there are standards, and that so when you get a pill, you know what's in the pill. But we're having the conversation, and that is a good thing. And someday, this really is a good bill.
Representative Weiss.
Well, thank you, Mr. Speaker, members of the Assembly. I guess just a couple things that I didn't mention to make clear, that again, this committee wasn't just looking at it because we hate marijuana, but this is a study that came out of Colorado, who of course has had medical marijuana and now legal marijuana. In the 5 years preceding them passing medical marijuana, there had never been a case of a child coming to the ER, say for marijuana overdose. In the 2 years after medical marijuana was legal, 14 were admitted to the ER, 7 of those were admitted to the intensive care unit. So that's what we're really getting at. There are issues with, one, who gets their hands on it, what the dosages are, and the risk then to some of those, inadvertent risk to some of those that can cause maybe more damage than good. So again, I would urge this body to give this bill a red light.
Representative Rohr.
Thank you, Mr. Speaker. Members of the Assembly, I just want to tell you that there are no randomized controlled trials that would indicate or recommend safe use of marijuana. I would vote red.
Is there further discussion? Seeing none, the House has before it for final consideration House Bill 1430. The clerk will open the key and you may record your vote. Has every member voted? Nelson votes no. Representative Mock? Nelson votes no. Do any members wish to change their vote? The key will be closed and clerk will take the record. The final vote shows 26 yea, 67 nay, 1 absent and not voting. House Bill 1430 is declared defeated.